Hello to all of our members. This is Katie Capps, Executive Director and co-founder of the Get the Medications Right Institute, and I'm here with you today with an update on our activities that occurred in November and those upcoming in December. Our over 1,150 members and leadership continues to grow. Genentech has recently joined the Institute as a strategic partner. We're happy to have their leadership and expertise on board. Executive members and strategic partners support the Institute through funding and participation in our work groups. They support the work produced here at the Institute with their time and financial contributions, and that allows us to overcome barriers to achieving medication optimization through comprehensive medication management and practice. So thank you to all of those organizations who play a huge part in financial support of the Institute. You help us advance our mission and vision to get the medications right. Having dedicated members is also crucial to our success, but funding our work is essential. If you would like to further commit to the Institute as an executive member or strategic partner, or if you would just simply like to make a contribution to support our work, please contact us. You know, employers as health plan sponsors want to build a better healthcare system. They want to decrease waste and ensure access for their employees to an effective, efficient, low-cost, and high-value care system. They want to ensure access to services that are of the highest quality, those services that are safe, and most importantly, those services that are appropriate. They have the contract authority to make it happen. Now, recently we published an issue brief following our webinar with Cheryl Larson, President and CEO of the Midwest Business Group on Health. Cheryl is also a member of the GTMRx Employer Toolkit Task Force. Now, I'll talk to you a little bit more later in my remarks about the webinar, but I want to discuss with you some key highlights of the issue brief. Cheryl outlines strategies to battle waste while improving care. She offers examples of employers who are focusing on medication management and those employers that are moving beyond medication therapy management to comprehensive medication management. She talks about which patients benefit the most from CMM, and she challenges us to rethink our drug benefit design strategy. You can download that issue brief by visiting our resource center. Now, in November, I am so delighted to say that 475 of our 1,150 plus members registered to attend one of our 4-part member feedback series. These events offered a progress update on the GTMRx workgroup activities, and we ask for vital member feedback to guide the work of the workgroup as we move forward. They also were asked to give us feedback on tools developed by these workgroups, and these tools were developed by over 140 GTMRx experts and focused on areas such as how we pay for care, how we practice care, how we use diagnostics, and how we integrate technology. The tools that were discussed offer guidance, evidence, and use cases. And if you missed this, you can hear the recordings of those member series under the membership tab on our website. If you were able to join us for the events, I want to thank you. Your insight as a member of the Institute is invaluable to us. Now, let me give you a brief overview of the type tools that we will be releasing in December and January and February that were developed by our workgroup leadership and our members gave us feedback on. There are 4 use cases of CMM in practice, and they cover a variety of settings. 2 health plans, a federally qualified healthcare center, and a health system. They also come from various regions of the country, California, Minnesota, Hawaii, and others. And these use cases highlight the results and outcomes, and they include major improvements with a listing of the return on investments for these programs. There are also 2 pharmacogenomics tools. There's a case study on the cost effectiveness of multi-gene pharmacogenomic testing in a Medicare population. And then there's a very important evidence document that outlines peer review evidence on quality, access, and cost of implementing an integrated pharmacogenomics testing within CMM in team-based care. So I encourage you to visit the Resource Center and download those tools. Additional tools include a frequently asked question document for employers, and it will guide you in your discussions with employers as health plan sponsors. There's also a very informative infographic targeted at employer populations or employers as health plan sponsors. I'm very excited to tell you that there is a summative review document. While not available yet, it will be available after publication. The GTMRx Institute has submitted for peer review publication an article entitled Assessing the Impact of Comprehensive Medication Management on Achievement of the Quadruple Aim. This is the first paper that's been submitted on behalf of the Institute to a peer review journal, and it outlines the impact of CMM on offering better care, lower cost, and higher provider satisfaction. And I can't wait to share this paper with you. We believe that it will be a vital tool in moving forward. Now, in the foreword of that article, the authors discuss the history of coverage of MTM services through the Medicare Modernization Act. They also discuss the differences between comprehensive medication management and traditional medication therapy management services. There's also a discussion around the gaps in research around comprehensive medication management, as well as opportunities to measure and evaluate CMM services in practice. So please look forward to those tools. In order for our membership to find and utilize those tools, we've created a soon-to-be-released resource center, which will feature a searchable landing page for all of the tools. We'll be sure to let you know as soon as that becomes available. Once that happens, please shamelessly share these with your colleagues, friends, and anyone who you think may find them useful and valuable in advocating for medication management reform. Now, I mentioned to you earlier the webinar that we sponsored with the speaker, Cheryl Larson, the CEO of the Midwest Business Group on Health. I'm going to give you a little sneak preview into her presentation. If you tune into Cheryl's webinar and download the issue brief, you'll find more information on what employers are doing as they move forward in the development of their health benefit strategy. But I think it's important to point out that in a recent National Alliance survey, 50% of employers are already using medication therapy management programs as part of their drug management strategy. Another 18% are considering MTM over the next 2 years. But many employers may be uncertain about how to implement a comprehensive medication therapy management program. The National Alliance survey that I mentioned before found that 22% wanted more information on MTM. As you know, MTM encompasses a wide array of services. During her remarks, Cheryl indicated that increasingly employers and other stakeholders are looking at a more integrated and comprehensive approach that will improve clinical outcomes and eliminate wasteful spending. We believe that these survey findings offer the Institute a real opportunity to showcase the difference between CMM and traditional MTM programs that may only focus on adherence. And you've certainly heard me mention many times, if you are adhering to the wrong medication, it may make you sicker, it may put you in the hospital, or worse. It can certainly drive wasteful spending if it is not the appropriate medication. So our forthcoming employer toolkit that Cheryl is also working with us, along with 9 other Business Coalition executives on designing, will become an even more valuable tool. Now, a second resource that I want to point out to you follows the member feedback event in November, and it highlights an evidence document that was created by GTMRx's Precision Medicine Enablement via Advanced Diagnostics Workgroup. Now, that workgroup is co-led by Jill Bates. She's a PharmD with the PHASER program at the Veterans Health Administration, and it's entitled The Outcomes of Implementing and Integrated Pharmacogenomics Within Comprehensive Medication Management in Team-Based Care. The evidence document articulates the value of pharmacogenomics in the context of comprehensive medication management. In her blog post, Dr. Bates points out the important opportunity we have to look at CMM as a care process that can leverage and utilize pharmacogenomics testing. That, she indicates, can take us from precision medicine to a more personalized approach to medication. In addition to the resources that have been created over the past month, GTMRx has also been busy attending and presenting at various conferences. On Thursday, November 12th, Steve Chen and I spoke to the Healthcare 21's 8th Annual Pharmacy University. Healthcare 21 is a nonprofit, employer-led business coalition of healthcare leaders and other stakeholders with the mission to create one voice to build a value-based healthcare market. We've mentioned before that employers demand high-value care, the right drug, the right patient, the right time, the right cost. At this online event, Steve and I discussed how employers can leverage CMM to get the medications right. In addition to the November presentation, on Tuesday, December 1st, I gave another virtual presentation to the Joint Commission of Pharmacy Practitioners, JCPP. JCPP is the largest professional delegation representing the interest of pharmacists within the United States. They represent 13 professional associations in the field of pharmacy, and they develop consensus directives for the profession. In addition to the JCPP presentation, on that same day, the Institute sponsored and supported the PCC's virtual conference on reimagining primary care. As you know, the Primary Care Collaborative is a not-for-profit multi-stakeholder organization dedicated to advancing primary care. It represents a broad group of public and private organizations that support growth of high-performing primary care to achieve the quadruple aim: better care, better health, lower cost, and greater joy for clinicians and staff in the delivery of care. All three of these events, with partner organizations and other members of the Institute, offer us valuable insight, and they help us spread our mission and vision to various sectors of the healthcare industry. We will certainly be attending more events like this as we move forward into 2021. Speaking of spreading our mission and vision, in a just-released episode, I appeared as a guest on GenXy's Precision Insights podcast. The Precision Insights podcast is a podcast series that consists of inspiring conversations around precision medicine with industry leaders and innovators that share cutting-edge technologies, processes, and initiatives in precision and personalized medicine. During my podcast series, I discussed some common myths about CMM and how it differs from MTM. I also talked about how pharmacogenomics testing can be used to optimize medication use as long as it is implemented as part of the CMM process. Be sure to listen to this podcast. Speaking of podcast, you should tune in to GTMRx's Voices of Change. We will soon be releasing an episode featuring Liz Helms, executive member of the Get the Medications Right Institute and CEO of the California Chronic Care Coalition. In her episode, Liz offers some unique and fascinating insight on the consumer's point of view. She talks about the stake they have in ensuring that they get the medication right. Patients as consumers of healthcare are often lost and confused. Oftentimes, they don't know about their own care plan or their medication plan. They don't know what questions to ask or even if they should be asking questions. So together, Liz and I discussed why the patient must be recognized as a full member of the interprofessional team. Patients have a role in the development of their own medication plan. So look for that new podcast. Now that brings me to the end of my update, but I'd like to thank you for listening. Our sincerest gratitude goes out to all of our members, especially those who are on the front lines demonstrating bravery and commitment in the face of these challenging times. If you have any questions or would like to get involved with our work, please contact us. We would love to have more hands on deck. We at the Get the Medications Right Institute would like to wish you, your family, friends, and colleagues a happy holiday season. We don't have to shake hands to join hands. We look forward to the year to come and the continued growth of the Institute. I would like to thank you for your support and belief in the work that we are doing. Until we speak again, be well.